just finalised the contracts on the CTICC as the first of our additional facilities outside of the hospital. So we have a projected bed shortage. We have that across intensive care beds and acute hospital beds. We have a plan for about 1,400 acute hospital beds, of which 857 will be at the CTICC. We actually started planning this way back in mid-March, and as you also heard from the Premier, it's been an absolute pleasure to work with the team. Engineers, architects, nurses, a whole wide range of people have been working around the clock to make this facility ready. It is going to be ready by mid-June at the very latest. Potentially the first week of June we'll be able to open. It'll have 857 beds scattered across 4 very large wards. We have a staffing plan that we've put in place now. We now need to get the staff ready, but we'll be having specialists there in emergency medicine, family medicine, internal medicine, experienced nurses from within the hospital system, and we'll obviously have the full range of hospital support services. This will run like a hospital, so it will have, at the peak, it'll have up to 200 admissions and 200 discharges a day, which will make it really one of the biggest hospitals in the province, if not the country, and one of the busiest. So we've had to put a lot of thought into the systems to support that. We have waste management systems, we have to provide meals 3 times a day to patients, we have all the support services like X-ray on site, we have state-of-the-art ultrasounds that the specialists will be using, and the NHLS is supporting us with hourly courier services to get to their lab so that we can have blood tests within a very short space of time. This facility will only take patients who have tested positive, who've come to a hospital and need a hospital bed, but don't need an intensive care bed. So we'll provide oxygen at all 857 beds. 40 of them will be able to provide a higher level of care than the majority. So if someone gets sicker at that site but isn't sick enough to go back to the hospital, we'll be able to care for them there also. And the team will have the experience and expertise to do that. Patients will come and move back to the hospital if needed by the ambulance services and the health net services that support them. And we'll expect to have to bring on a couple more facilities within the next month or so. That we have well advanced plans for at least 2 more facilities that are just a little bit behind the CTICC in terms of completion. So I think that's all I would say about that for now. Obviously, there's a lot of detail. I don't want to go into too much technical detail, but just to conclude again, it's been an absolute pleasure to work with such a smart and dedicated team. Thank you.